What blood tests screen for primary aldosteronism? Have you ever wondered how doctors screen for conditions that can cause high blood pressure? One such condition is primary aldosteronism, which can lead to hypertension that is hard to treat. Understanding the blood tests involved can help you grasp how this condition is diagnosed. The primary blood test used to screen for primary aldosteronism is called the aldosterone-to-renin ratio. This test measures two important hormones in your blood: plasma aldosterone concentration and plasma renin activity. In primary aldosteronism, the plasma aldosterone concentration is usually elevated, while the plasma renin activity is typically low. To find the aldosterone-to-renin ratio, doctors divide the plasma aldosterone concentration by the plasma renin activity. If this ratio is greater than 20, it strongly suggests that primary aldosteronism may be present. In addition to the aldosterone-to-renin ratio, doctors often check potassium levels in the blood. Low potassium levels, known as hypokalemia, can occur in this condition. However, it is important to note that not everyone with primary aldosteronism will have low potassium levels. In fact, normal potassium levels do not rule out the condition. If the aldosterone-to-renin ratio indicates a potential issue, further tests may be needed to confirm the diagnosis. One such test is the fludrocortisone suppression test. In this test, patients take fludrocortisone and have their aldosterone and renin levels measured in a controlled setting. If aldosterone does not decrease, it confirms primary aldosteronism. Another confirmatory test is the captopril challenge test. After taking captopril, a medication used to lower blood pressure, doctors measure aldosterone levels again. In individuals with primary aldosteronism, aldosterone levels remain as high, while renin levels stay low. This is different from what happens in people without the condition, where aldosterone levels would typically drop. Routine blood tests also include checking electrolytes, especially potassium and sodium. Since excess aldosterone can lead to potassium loss and sodium retention, these tests are important. High blood pressure and complications like arrhythmias can arise from these imbalances. In summary, the key blood tests for screening primary aldosteronism in patients with hypertension include the aldosterone-to-renin ratio, serum potassium level, and confirmatory tests if the aldosterone-to-renin ratio is elevated. These tests help identify individuals whose hypertension is linked to excess aldosterone, allowing for more effective treatment options.